for our cancer patients. In the world, every year, 1 million new gastric cancer patients occur. Most of them are advanced stage or stage 4. Stage 4 means too much advanced. Gastrectomy does not help and cannot survive long, which is very tragic to family and our society. As a gastric cancer surgeon, when I was invited to some countries, I was told that the most common operation in that country for gastric cancer is only diagnostic laparotomy, expecting to survive only few months. Korea has the highest gastric cancer incidence in the world. Japan, the third or fourth. In these two countries, government provide health screening program. Now more than 70% of gastric cancer patients are early stage. That means they survive and return to their family and continue their profession. Like other cancers, gastric cancer does not have symptom in early stage. Even in advanced stage, sometimes no symptom. To improve gastric cancer survival, but also help our gastric cancer patients, we need to raise awareness and share knowledge on the treatment, how it is working, side effects, and how to handle those complications. I found a dedicated gastric cancer foundation for patient advocacy group in the United States, Debbie's Dream Foundation. During preparation of today's symposium together with the DDF, this virtual program can be a much easier way of sharing knowledge. Today, you will hear how Korea and Japan succeeded in saving gastric cancer patients, discussion on surgical approaches such as open surgery, laparoscopic surgery, and robotic surgery. Also, any development of a new chemotherapy. You will also hear patients' voice. I appreciate their courage to come out to share their experience. We have over 900 pre-registration from 48 countries for this symposium. The world became rather closer. Finally, I appreciate the leadership of a Korean Gastric Cancer Association, Japanese Gastric Cancer Association, and the Chinese Anti-Cancer Association, especially Professor Bae, Professor Kodera, and Professor Jijiao Fu, who did not hesitate to support this symposium. I also thank medical industry for their generous support this symposium. Korean Cancer Association will continue this effort to share knowledge on cancer treatment. Now, it is my privilege to introduce Ms. Andrea Eidelman, CEO of Debbie's Dream Foundation.
Thank you, everyone, for joining us today for the 2021 International Gastric Cancer Educational Symposium, hosted by the Korean Cancer Association and Debbie's Dream Foundation Curing Stomach Cancer. Also, thank you to our supporting partners, the Korean Gastric Cancer Association, the Japanese Gastric Cancer Association, and the Chinese Anti-Cancer Association, and the physicians, patients, and caregivers that have assisted in organizing and participating in this event. I am Andrea Eidelman, the CEO of Debbie's Dream Foundation. I would also like to take a moment to thank our generous sponsors. Platinum sponsors, Bristol Myers Squibb and Merck. Silver sponsors, Astellas and Taiho Oncology, and bronze sponsor, Zymeworks. The mission of Debbie's Dream Foundation is to raise awareness about stomach cancer, advance funding for research, and provide education and support internationally to patients, caregivers, and families. Our ultimate goal is to make the cure for stomach cancer a reality. Pictured here is Debbie Zellman, the founder of Debbie's Dream Foundation. DDF was founded by Debbie Zellman in 2009, 1 year after she was diagnosed with stage 4 incurable stomach cancer. A 40-year-old mother of 3 and practicing attorney, Debbie had no symptoms or risk factors for the disease. At the time of her diagnosis, she was given a 4% chance to live 5 years. Debbie fought for 9.5 years, facing many reoccurrences and harsh treatment regimens. When she was diagnosed, Debbie was surprised to learn that there were few treatment options available and little research taking place for gastric cancer. She founded DDF in 2009 to raise awareness for stomach cancer and advocate for increased funding for research. Sadly, Debbie passed away December 23, 2017, but her legacy continues through DDF. Funding research for gastric cancer is of utmost importance and at the heart of the mission of DDF. DDF has partnered with the American Association for Cancer Research to offer grants for basic, translational, and clinical research in stomach cancer. The AACR ensures that research proposals are put through peer-reviewed MET guidelines and criteria throughout the length of the grant. To date, DDF has funded grants totaling $1.2 million. DDF offers many free programs to the stomach cancer community. Some of the ongoing initiatives include our PrEP program, Symposia, webinar series, and our nutrition educational programs. PrEP is one of the largest programs that encompasses the general mission of the foundation in providing education and support internationally to the stomach cancer community. The PrEP program includes mentoring, advocacy and outreach, virtual support programs, the Dream Makers Miracle Fund, clinical trials matching services, and an online support community. As part of the PrEP program, we are able to connect those feeling alone in their diagnosis with others who know exactly what they are going through. Our mentoring program provides patients and their families, patient survivor and caregiver mentors based on age, location, stage, and biomarkers. Our monthly stomach cancer support groups are led by a licensed clinician and are a huge resource for newly diagnosed patients. We also have an online discussion community where patients can remain anonymous and seek support and guidance from each other. Under PrEP, our Dream Makers Miracle Fund was a 2020 new initiative. We were able to grant wishes to patients and their families to create lasting memories. Here is some pictures of our award winners. The Feast family went to Disney World. Joey Feast was diagnosed at age 17 with stomach cancer, 6 years after his brother died of stomach cancer at just the age of 20. So cancer has affected their family tremendously. Also, we were able to grant Kenny Ricard his bucket list wish of skydiving, which was featured on the local news. Also through this initiative, we were able to host a toy giveaway in December, where we were able to give children under 18 holiday gifts. As part of our mission, we advocate for early detection and provide community and education and outreach to physician nurse navigators, hospitals, legislatures, and disparate communities affected by stomach cancer. We also have 32 chapters throughout the states and overseas who are strong advocates and spread awareness to their local community about this cancer. Each year, patients come together at our annual Debbie's Dream Advocacy Day with the ultimate goal of securing funding from the Department of Defense's peer-reviewed cancer research program, which allocates funds for stomach cancer research. Last year, our webinar series program hosted 6 informative educational webinars. This year, the series launched in January, featuring Dr. Craig Lockhart discussing on perioperative chemotherapy. The NCCN spoke on the stomach cancer guidelines in February, and in July, Dr. Laguna will speak on HIPEC. Each September, we also host our clinical trials updates webinar. And at the end of the year, we will be partnering with Cancer Care to host an informative webinar on how to talk to your kids about the cancer diagnosis. Despite the challenges of the pandemic, we hosted 3 successful online symposia in 2020. This year, our series launches with this virtual event highlighting gastric cancer treatment in the East and West and addressing how we can better bridge the gap in treatment. In July, we will host a live event at Mayo Clinic in Minnesota, and in November, we will be traveling to South Korea for our international symposia event. Stomach cancer patients and caregivers need simplified answers to help them maintain proper nutrition post-diagnosis and gastrectomy. We offer education around nutrition through our webinars, symposia, recipe books, and content from our website to help empower our patients and educate them through their own nutritional journey. In May, DDF launched a stomach cancer hotline in partnership with Cancer Care, where licensed social workers connect with patients to address financial, emotional, and practical changes that face our stomach cancer community. In 2020, we also launched the COVID program, which continues through this year. The pandemic brought about so many challenges for the stomach cancer patients and their support systems. Through this initiative, we were able to provide COVID educational webinars, free COVID kits, and meal delivery services through Instacart, as well as launching the Mind, Body, Spirit, Mental Health series on Facebook Live. We are so proud that our programming content is reviewed by our esteemed Scientific Medical Advisory Board. Also, many of our members host educational webinars and contribute to our symposia events year-round. We would like to thank our program chair, Dr. Han Wan Yang, for all his hard work and dedication. Also, thank you to the Korean Cancer Association and our supporting partners, the Korean Gastric Cancer Association, the Japanese Gastric Cancer Association, and the Chinese Anti-Cancer Associations, and also the physicians, patients, and caregivers that have assisted in organizing and participating in this event. Thank you to our generous sponsors who also made this event possible. Platinum sponsors, Bristol Myers Squibb and Merck. Silver sponsors, Astellas and Taiho Oncology, and bronze sponsors, Zymeworks. If you would like to learn more about getting involved with DDF, you can visit our website at www.debbiesdream.org to learn more.
I'm Debbie Zellman. I'm president and founder of Debbie's Dream Foundation. And why am I here, right? I was diagnosed at the age of 40 with stage 4 advanced incurable stomach cancer. I had no risk factors of the disease, no thoughts that I could possibly have stomach cancer. And the 5-year survival when you're diagnosed with stage 4 stomach cancer is only 4%.
I was basically told you have a few weeks to live. So I started my treatment, and thankfully I responded to that treatment. And together with my son, we talked about making a difference for others while I was closing down my law practice and fighting for my life.
I actually founded Debbie's Dream Foundation, Curing Stomach Cancer, to help the so many who don't respond to the chemotherapy that they're given and understand the chemotherapy that I was given was about 30 years old. No advances had been made.
They did an endoscopy, and right at the GI junction of the stomach and the esophagus sat a tumor that had been bleeding, and profusely bleeding, and so that was the symptoms I was having was from blood loss, and my body was essentially shutting down. And so the day before my 33rd birthday, I got the phone call to say that I had cancer.
I was doing pretty good. The blood in my stool was my only symptom, and so I brought my 6-year-old son with me to this appointment. And when I showed up there, he says, "I don't have the results yet, I'll give you a call." And I'm just like, okay, no big deal, right? So like he obviously knew. He did this on purpose. He didn't want to tell me in front of my son.
Cancer has taken away the idea of possibly having kids. Because why do I want to bring kids into this world when there's no guarantee that I might not be here for them?
It's more like every day could be your last now, which is a different way of ever lived. You know, I always thought you would live to, till you're old. And you can see your kids grow, and that's how life's supposed to be. You have grandkids. And it's not like that anymore.
Cancer robbed me of my wife of 21 years. It robbed my kids of their loving mother. We'll always have a void.
Cancer does not discriminate. It doesn't care how old you are or your education level. It doesn't care about your financial status or what job you have. It doesn't care how smart you are or if you have young children or loved ones who depend on you. It just invades your body, and it will do whatever it takes to survive.
It takes the tenacity in people from Debbie's Dream Foundation and other foundations of other cancers to bring that awareness.
To say that we need more awareness, we need more research. We have our vets overseas right now that are fighting for our country, coming back with H. pylori that turns into stomach cancer, and we don't even have awareness for them.
So our mission is to raise awareness, to fund research, to advocate for more research funding, and to educate and support patients, families, and caregivers internationally.
Debbie's Dream Foundation is the most effective advocacy group for gastric cancer in the country. Its website is rich in detail. It's a place where all stomach cancer patients, whether they're just diagnosed or fighting the disease, should go for information and resources.
I think in the next decade, there has to be more attention to rarer cancers. Stomach cancer, I think, is number 2 from the bottom of the list as far as available funding for research, and that's crazy.
Hi everyone, it's Zach. For those who don't know me, I'm the son of Debbie, the founder of Debbie's Dream Foundation. I'd just like to thank everyone for your continued support of Debbie's Dream Foundation. I'd also like to stress the importance of keeping up our efforts in the battle to cure stomach cancer. It's crucial that we keep the fight going and press harder than ever, because that's what my mom would have wanted us to do. Thank you all for donating your time, energy, and resources towards this amazing cause, and let's keep fighting.
Thank you so much for your support. It helps us continue the fight and to achieve the dream of someday curing stomach cancer.